Okay, so I got this patient, right? And he's got one of these, backs. He's got one of these like low backs. Not that low, but a back. Anyways, it's probably got a few vertebrae there. It's like an L5, 4, 3, 2, 1, and there's a T12 on top of that. And that's important because that's the other spine. That's that thoracic spine. We're looking at the lumbar spine now. That's what's important to us at the moment. Anyways, they're here for a reason because they always come in for a reason. It's never just for nothing. That would be boring. Why would they come to you if that was the case? So anyways, this lumbar spine has pain on one side. We're looking at the back, so it's pain on this left side over here. And I don't know, there's probably some like lightning bolts coming out of it, which are not fun. I don't recommend having lightning bolts. Anyways, the thing about that lumbar spine is it actually bent to this side. It is bent to the left side, shortened, if you will, on this side. And so that means the other side is being strained. If it's short on one side, it's long on the other, and that pain is coming from the strain. So we've got to figure out a way to get rid of that pain, and we take it away by going over here, but it's not that simple, right? There's muscles involved, firstly. There's a few muscles. Deep intrinsics, for instance. Our good friend, the quadratus lumborum, usually shares some of the load. And then by angulation, of course, we have the erector spinae. These are all important to deal with. We should really consider them. But again, it's not that simple. There is more than just a low back. Nobody comes in with just a low back. They couldn't walk. They need other things. They need a pelvis, for instance. And they might even need a leg, a lower limb, if you will. And of that lower limb, there's probably going to be a femur, and there's probably going to be a tibia, and maybe even a fibula if we're lucky. In any case, these are important. And the reason I say these are important is because they're not moving as they should. You'll find that the femur, in this case, is internally rotated. That's a transverse plane, and we have a vertical axis. And when we start to change the rotation of the femur, you'll notice that the hip joint, that femoral head on the acetabulum, starts to tighten up a little bit. And as we change the tension on those ligaments and the capsule, it shortens that joint just a tiny little bit, so that leg is a tiny little bit smaller by comparison. Well, as well, we actually have an externally rotated tibia, and this is again a transverse rotation on a vertical axis. When I start to change the relationship between the femur and the tibia, an internal rotation on top of an external rotation, you'll notice the femur drops in this way, and we get what we call a genu valgus strain or genu valgum. Either's fine, I'm not really concerned. But the fact is, the leg is now also shorter at the knee, and so overall, by comparison, this whole leg on the left side is just a little bit shorter, and that doesn't seem like much until we put a few years on top of it, maybe even a few decades. And as we go more and more, as we walk on it and as we stand on it, it creates a push. A relatively long leg versus a relatively short leg will push on that pelvis. This is a planar motion, coronal plane, and it takes what should be a relatively neutral pelvis and can turn it into a relatively up on one side pelvis, or a shifted innominate. In any case, we've got one side that's too high, one side that's actually pushing up into the short side we already talked about. So now, instead of it just being muscle, it's a vertical compression with a slight obliquity. It happens to be in the same angle as the muscles. So it's not just the muscles, is it? It's never just the muscles. That would be too easy. So this means that if I want to get rid of this pain, I've got to take care of the short muscles as well as the pressure vertically on the pelvis. And I've got to make this relatively long leg same length as the relatively short leg. To do that, I've got to unwind this whole thing. And plus I got to undo everything above it too, and that's kind of complicated. Hopefully that made sense. If you get a chance, check us out. Simple Lines Anatomy, Insta, Facebook, Twitter. We have an app for iPhone and Android if you like learning about anatomy.